Hi, I'm Rakia. This infection prevention and control education series is produced under the guidance of the Taiwan Medical Mission. Today, we'll go over the proper cleaning and disinfection of ventilator tubing. This process is key to preventing infections and keeping our patients safe, especially in low-resource settings. Let's get started. The purpose of this protocol is very simple. First, to ensure that all ventilator tubing is properly cleaned, without any remaining secretions or residue. Second, to reduce the risk of respiratory tract infections in our patients. Remember, every contaminated or unclean tube can become a source of infection. So, cleaning and disinfection are not just routine tasks, they are life-saving practices that protect both patients and healthcare workers. This protocol applies to all reusable equipment that comes in contact with the patient's respiratory tract. That includes ventilator tubing, Y connectors, and oxygen humidifier bottles. Every one of these items can carry secretions or bacteria from one patient to another. So, proper cleaning and disinfection of each part are essential to prevent cross-contamination and infection. Before starting the cleaning and disinfection process, make sure all materials are ready. You will need clean water, preferably boiled water for rinsing, soap or neutral detergent for washing, bleach solution for disinfection, cleaning brushes or cloth strips to scrub inside the tubing, clean towels or drying cloths, buckets or containers for soaking, and most importantly, personal protective equipment, mask, face shield, gloves, apron, and rubber boots. Remember, safety starts with proper protection. Always wear your PPE before handling contaminated items. Here are the key materials needed for cleaning and disinfection. Clean water, boiled water is preferred for better hygiene. Cleaning brush or clean cloth strips, to scrub both inside and outside of the tubing. Soap solution or neutral detergent, to remove secretions and organic matter. Bleach solution, 1:100 dilution, this equals about 500 parts per million, ppm, and is suitable for disinfection. Personal protective equipment, PPE, head cap, mask, face shield, waterproof apron, long gloves, and long rubber boots. Drying rack or clean cloth/towel, for air drying after cleaning. Make sure all these materials are clean and ready before starting the procedure. Before we start cleaning, let's look at the correct personal protective equipment. As you can see in the picture, the staff is fully protected. You must wear a head cap, a mask, a protective face shield, a waterproof apron, long gloves, and long rubber boots. These protect you from chemical exposure, splashing water, and patient secretions. Remember, always wear full PPE before touching any contaminated equipment. Your safety comes first. The first step of the process is cleaning. Step 1. Disassemble all parts into their smallest components. Turn off the ventilator, disconnect the tubing, and separate all the parts, including Y connectors and humidifier bottles. This allows every surface to be cleaned properly. Step 2. Rinse all parts under running water. Use clean, running water to remove any secretions or visible dirt before using soap or detergent. This step helps to wash away most of the organic materials that can block proper disinfection later. Remember, do not skip the rinsing step. If secretions remain, the disinfectant will not work effectively. Let's start with step 1, disassemble the tubing. First, turn off the ventilator power to ensure safety. Then, disassemble all parts into their smallest components. This includes tubing, Y connectors, and humidifier bottles. Taking them apart completely helps make sure that every inner surface can be cleaned properly. Next, step 2, pre-rinse. Before handling the used equipment, always wear full protective gear, mask, face shield, gloves, apron, and boots. Then, rinse all parts under running water to remove visible dirt, secretions, or dust. This is a very important preparation step before using soap or disinfectant. Now, let's continue with the next part of the cleaning process. Step 3, soak. After pre-rinsing, soak all parts in soap or neutral detergent solution for 15 minutes. This helps to loosen any dried secretions or dirt inside the tubing. Step 4, scrub. Next, scrub both the inside and outside using a cleaning brush or clean cloth strip. Be gentle but thorough, make sure all visible dirt is removed. Special attention should be given to the inner curves and connectors, where secretions often build up. Finally, rinse thoroughly with clean water to remove any soap residue. If soap remains, it can inactivate the disinfectant in the next step, so make sure the rinse is complete. Now we move to step 3, scrub. After pre-rinsing, soak all the tubing and parts in a soap or detergent solution for 15 minutes. This soaking time helps loosen any secretions or dried materials that stick inside the tubing. Then, scrub both the inside and outside surfaces using a brush or clean cloth strip. Do it carefully, make sure every curve, connector, and joint is cleaned properly. Next is step 4, rinse. After scrubbing, rinse thoroughly with clean water to remove all the soap. This step is very important. If soap remains, it can reduce the effect of the disinfectant in the next stage. After cleaning, the next step is disinfection. There are two methods you can use, the bleach method and the boiling method. Method 1, bleach solution, preferred. Prepare a 500 ppm bleach solution, which is the same as a 1:100 dilution of household bleach. Soak all parts in this solution for 30 minutes. Make sure the items are completely submerged and the container is covered to reduce chlorine loss. Method 2, boiling, alternative. If bleach is not available, you can use boiling water instead. Boil all parts for 15 to 20 minutes. This method is suitable only for heat-resistant materials, such as silicone. Do not boil PVC parts, they may deform or melt under heat. Now we move to step 5, disinfection. First, prepare a 500 ppm bleach solution, which is the same as a 1:100 dilution of household bleach. Then, soak all parts for 30 minutes, make sure everything is fully submerged. If bleach is not available, use the alternative method, boiling. Boil the parts for 15 to 20 minutes. However, remember, boiling is only for heat-resistant materials like silicone. Do not boil PVC tubing or connectors, as they may deform or melt under high temperature. Always handle disinfected items carefully, and avoid touching them with bare hands before rinsing and drying. Now we're at the final 3 steps of the cleaning and disinfection process. Step 6, final rinse. After using bleach, rinse all parts with boiled water to remove any chlorine residue that could irritate patients' airways. If you use the boiling method for disinfection, no rinse is needed because the items are already clean and sterile. Step 7, air dry. Place the items in a clean, well-ventilated area to air dry. Avoid direct sunlight, as heat can damage some materials. Never wipe the inside of tubing with a cloth, just let it dry naturally. Step 8, storage. Once everything is fully dry, wrap the items in a clean cloth or plastic bag to keep them dust-free and ready for next use. Make sure to store them in a clean, dry, and protected location. After disinfection, proper drying and storage are very important to prevent recontamination. You can use a dryer machine if available, or simply air dry the tubing in a clean, well-ventilated area. Make sure there is enough space between each tube so air can circulate freely. Avoid direct sunlight or dusty environments. Once the tubing is completely dry, wrap it in a clean cloth or a plastic bag. This helps protect it from dust, insects, and environmental contamination. Label the bag with the date and initials if needed, so it's clear when it was last disinfected. Here you can see a real example of a respiratory therapy sterilization room. This is where all cleaning and disinfection of ventilator tubing take place. On the left, you can see the washing and soaking area, where staff clean the tubing using soap and bleach. In the center and right photos, we have drying cabinets and sterilization equipment, used to dry and store the tubes safely after disinfection. Each package is labeled with the date and initials, to show when it was disinfected and by whom. This helps maintain accountability and traceability. A clean and organized environment like this ensures that every ventilator circuit is safe to reuse, and that infection control standards are followed strictly at every step. Before we finish, let's review a few important precautions to remember. First, always wear full PPE. This protects you from chemical exposure and from patient secretions during cleaning. Second, discard any tubing that is damaged or cannot be cleaned properly. Reusing broken or contaminated equipment increases the risk of infection. And finally, always disinfect tubing between different patients. Never reuse without proper cleaning and disinfection, even if the patient seems stable. These precautions help keep both patients and healthcare workers safe, and they reflect our commitment to infection prevention and quality care. These are the international references used for this protocol, mainly from WHO, CDC, MSF, and Rudalla and Weber, 2019. They ensure that our cleaning and disinfection procedures follow international infection control standards. Now, let's also review the cleaning of the urine measurement cup, because it's another reusable item that often gets contaminated. The same infection control principles apply here. Always wear PPE, gloves and apron at minimum, and follow a clear cleaning sequence. Empty the urine carefully into the toilet or sluice, avoiding splashes. Rinse with cold running water to remove visible waste. Wash with warm water and neutral detergent. Use a brush if needed. Rinse again with clean running water. Disinfect using a 0.5% chlorine or approved solution, making sure it stays in contact for the full required time. Air dry completely in a clean, designated area before storage. This simple routine helps prevent contamination and maintain safety for both staff and patients. Now, let's go through the cleaning process step by step. 1. Start with hand hygiene. Always wash your hands with soap and water or use alcohol rub. 2. Wear your PPE, gloves and apron, and a face shield if there's any splash risk. 3. Empty the urine carefully into the toilet or sluice, avoiding splashes. 4. Rinse the cup with cold running water to remove visible waste. 5. Wash the cup with warm water and neutral detergent. Use a brush if needed. 6. Rinse again with clean running water. 7. Disinfect using an approved solution, such as 0.5% chlorine, and make sure to allow full contact time. 8. Air dry the cup completely in a clean, designated area. 9. Store it in a clean, dry, covered space. 10. Dispose of PPE and cleaning materials properly as per infectious waste protocol. 11. Perform hand hygiene again after removing PPE. 12. Inspect the cup regularly, and replace it immediately if it's cracked or damaged. By following these 12 steps carefully, you help prevent contamination and maintain safe standards in patient care. Thank you everyone for your attention and participation. Today, we reviewed how to properly clean and disinfect ventilator tubing and how to apply the same infection control principles when cleaning other reusable items, like urine measurement cups. Remember, clean, disinfect, and protect, every step matters. Each careful action you take helps prevent infection and keeps our patients safe. Thank you again for your hard work and commitment to infection prevention.